Hey, everybody. Before we get into this episode, we just wanted to give a little bit of a forewarning that we're going to be talking about some heavy subjects surrounding mental health, addiction, and substance abuse. So if you have any problems with that or are triggered by those topics, please proceed with caution as we get into it. Okay. Alcohol withdrawal is one of the few um, withdrawals that you can die from.
Regardless of whether you're physically dependent on it or you're in full blown addiction, you can't stop drinking without there being horrendous, potentially life threatening side effects.
He said he had tried to stop multiple times and he couldn't without getting sick.
There was a point where I was like, is he having an affair? Well, yeah, he was having an affair with alcohol.
One side of him was saying, "You can't give this up. It's the only thing that makes you feel better." And the other side of him was saying, "This is destroying your life. You have to do something about it."
He was aware of the fact that, you know, people would look at him differently if they knew what was going on.
But he was in his own deep, dark pit of despair. And, for a long time, we had no idea how bad that was.
Hey, how's it going?
It's going. So we sit down, we have this conversation, um, and he tells me I drink a lot. Now, as a 17-year-old who has not really had much experience with, you know, addiction or any alcohol abuse or even mental health issues at that point, um, very much at least. I struggled with my own kind of anxiety and stuff off and on, but nothing to that extreme. I really didn't know how to react to that, and I really didn't know what that meant. And I remember asking him, like, what do you mean you drink a lot? And he said, and I said, how much? And he said, a lot, like, um, like half a bottle of vodka a day, multiple beers a day, um, at times. And I said, well, what do you mean? And, I kept kind of questioning him. And my initial reaction, kind of as a naive 17-year-old in that conversation, was like, oh, it's not that big of a deal. Like, we can get around that. We can fix that. And he said, and I was like, we just, we'll cut back on the drinking. Like, we don't have to, you just don't need to drink that much, and problem solved kind of mentality, which obviously, looking back, was a very naive way of looking at it. But I remember he was very adamant that at that time that I didn't tell you about it. Um, and I kind of questioned him as to, like, how did that start? Like, what happened? Like, how did you start drinking so much? And he told me this story about how, you and him kind of had, throughout your marriage, uh, you kind of had it was kind of a common argument between you two of how he drank. And and recently, or fairly recently, you guys had a conversation about that, where he had agreed to kind of cut back. Um, and then he said one night you had like a study night or something with people from nursing school at your house, and he was there, and he had some drinks, and he had been drinking beer from the fridge. um, and then at the end of the night he realized how much how much was gone. And so he didn't want to get into an argument with you about it. And so he went to the store and bought beer and replaced what was in the fridge. And then the next day he had a few more, and then he did the same thing, um, because he didn't want to get into that argument about it. And then he kind of explained that after a while it snowballed, and he realized that he couldn't keep doing that without you noticing. And so he switched to vodka, and started hiding it out in the garage. And that obviously explained why he kept going out there. Um, but it was a very short kind of conversation as to how he explained his snowball into what I later learned was full blown, alcohol addiction. Um, but again, in that moment, it was just kind of like, I was trying to process this all as a 17-year-old, and he was very adamant that I not tell you. He was very adamant that he could fix it himself. And I just was like, no, I don't think you can. Like, I think you need help. Um, and so I went up and I woke you up and I told you, like, hey, I finally figured, like, Dad and I just had a conversation and I figured out what's been going on with him lately. He told me that he drinks a lot, and then, he kind of was lingering in the background when I told you that, because he kind of followed me up the stairs, but like wasn't going to stop me because I think he recognized at that point that he needed help, but he didn't really want to admit it. Um, and I remember waking you up and you were kind of in a daze, and you like, I don't know what you remember about that moment, but
Yeah, I'm not sure. I think I was working overnight the night before, and like I don't know if I just went to bed late that day, so I think I was really tired. I do know that. Um I do remember you waking me up and telling me, and I was just like, "Oh my goodness, that just makes so much sense." Like it just all clicked into place for me.
yeah. And then I remember you kind of, in that moment, you jumped up, fairly quickly, and kind of went into like go time mode, of like crisis management mode, because you finally had an answer to everything that was going on. And you were like, we need to go to the hospital, you need to go to detox, all of these things. And at this point I didn't really understand, what the reason was of all this, but you kind of explained to both me and my dad at that point that, like, you being in nursing school, you also at that point were working as an LPN on a cardiac floor, and so you had dealt with alcohol withdrawal before. And now I know, having worked on that same unit and also in the emergency room, that like alcohol withdrawal is one of the few um, withdrawals that you can die from.
It's
Alcohol
the
and
it's
benzos are the only
yeah.
two
It
withdrawals that you can die from the actual withdrawal. And
yeah.
that happens because they're both CNS depressants, or central nervous system depressants, and your body gets you when you're drinking so much or taking too many benzodiazepines, your nervous system starts basically firing a real layman's way of explaining it is your nervous system basically starts firing at a much lower rate. Um, and then, because of the substance depressing it, and then when you stop drinking or you stop taking pills, um, all your nerves start firing at a normal rate, but your body's not used to it. And so you can start having seizures related to the withdrawals. And if a seizure goes on for long enough, you can die from
You
it.
can
And
also
so,
have cardiac you can also have a cardiac arrest. So those are the two big medical risks for the withdrawal is either a cardiac arrest or seizures that can cause, brain damage and things like that. So it's a very very serious type of withdrawal, especially if someone has been drinking regularly, like daily, and tries to stop cold turkey. You can't. It's very very dangerous.
and mind you, kind of in this endeavor, as we're kind of finally figuring out what's going on with him, I had mentioned that this particular night, I had confronted him initially about his sleep issue, because I thought that he was in that state again, where he was acting really tired. He was acting intoxicated. Well, I found out he was intoxicated. It wasn't his
Mhm.
sleep episodes, which, you might be thinking um, that his sleep episodes were just him being drunk all along, but they weren't. That wasn't the case, because, as we
Mhm.
talked about in the last episode, with the visit to the doctor or to the emergency room, like, we had clear evidence at times that he did, and obviously eventually we got a sleep study. Like, he did have a sleep issue. He did have those episodes. They did become more frequent. Um, but that probably late that summer, he also started having an alcohol issue, and started drinking a lot. And when he finally admitted it to me, he was at a point where he said that he had basically been drinking that heavily, somewhere around half a bottle of vodka a day, maybe more, for like 3 weeks. He said he had tried to stop multiple times and he couldn't without getting sick, which was obviously the withdrawals. So the only thing that would make him feel better was the alcohol,
One,
which,
let me stop you too in that we'll go back to that in a minute because what he told you in the timeline was not necessarily accurate, but this is
right,
what you were this is how he was explaining it to you.
right. Well, and that's the thing is I'm sure first of all, he probably was not the most truthful in that moment either, because he still was
Mhm.
embarrassed and trying to hide things from us. But so his version of this story that we had heard at this point was not, we found out later, was not very accurate. But this is what he told us in that moment. And he had told, he had told us that he had been basically drinking nonstop for the last 3 weeks. And that kind of clicked into place as to why for the last month he had been having these sleep episodes basically every day, quote unquote sleep episodes, which really he was intoxicated. um
And he admitted later, in his just sidebar, when I did pull his therapy records after he died, he had admitted to his therapist that he recognized that he was aware of his behavior with those sleep episodes and the fact that it came across as him being intoxicated or under the influence of something. And so when this became a problem, which was a little bit earlier than the way he told it, he that was one of the ways that he was able to like subconsciously hide it, is
or play
because
play it off with us.
he had this condition that was a legit condition that did cause these symptoms, and which also explains why it was really difficult for us to see that that's what was going on.
Well, right, and like he used that as to his advantage in hiding his addiction, because again, the way that he explained the story was not fully accurate. Um he had these issues, or he was full blown addicted to alcohol much earlier than what he had explained. Um, and he used that as an excuse when we would get suspicious and we'd be like, why are you acting this way? And he almost would put that seed in and be like, oh, I'm just tired or whatever. Or we would get so used to it to the where we would just dismiss it as that. And again, we had no real reason to mistrust him because he had never lied to either of us ever,
Mm-mm.
you know?
No.
And
No.
and so all of this was kind of unfolding on this night, and it was very, kind of was a big hit to our family, in general, as to first of all, it's a lot to process for anybody, but um, so we're dealing with this, and we're finally learning about these weird behaviors and the issues that he's facing, that he's been hiding from us this entire time. And another thing, like with the alcohol part of it, is um he very much was high functioning.
Mm-mm.
And so that was another way that, like, we never ever would have suspected that it was alcohol, because part of the stigma, or the common um portrayal of alcohol use disorder, or alcoholism addiction, is like the angry, abusive drunk who's a deadbeat, and like, you know, um, or the dad who gets drunk and angry, and you know is um, rampages around the house and hits people and whatever. Like, he was the complete opposite of that, and he had a job and he held it down, and even you
He
know,
was very successful at his job as well. Like he
right,
had a career and in an industry where he was very highly regarded and held a position of responsibility and prestige in some levels. And yeah, and nobody, I mean, he was the first person up in the morning. He was, you know, he was always on top of everything.
Oh
He
yeah,
was always on top of stuff at work. Like nothing, there were no like, other than these weird behaviors, which we had a way of explaining off because of his medical issues, there were no like quote unquote traditional red flags that we necessarily completely picked up on because of, again, you kind of have these stigmas.
well, and there was no like slippage in in other parts of his life, like outside of his
Right.
relationships, with us and like his own mental health, I guess. It's not like he was missing work or like calling in he never called in sick. He never took a day off. He never neglected his responsibilities um as the head of the household or as the provider for us. um which oftentimes when addiction takes hold, like those are the things that start to slip, is your ability to like manage your life, and those parts he was very good at. It was his relationships that started to suffer, but again, those were attributed to his depression and whatnot.
Yeah, and it was more things that we noticed because we knew him so well. And I think it's important to note too that like for a year and a half prior, he slowly started showing signs of depression. He obviously had anxiety issues that we were well aware of, even though he was in denial about them. And then these sleep episodes or these, episodes continue to get worse and worse and worse. So even though he was high functioning and these areas, the other like more outward parts of his areas of his life were not out of control yet or, being affected in any sort of noticeable negative way. I
Emphasis
do
on
know
yet, right? Because
yet,
he was getting
because
there.
you can't maintain that. And at if he had continued, I think over that winter of that cycle of drinking, I think things would have started to fall apart. I think it would have started to affect his job. I think it would have affected his professional stuff. I think, there would have been a lot more external consequences or things that were starting to come together. But we never, he, there was intervention at that point in December. So,
Well, and realistically, he was at that point where things were starting to fall apart, where he was unable to manage things because
right.
he got to I think even subconsciously he was so. I think first of all he was very hard on himself, so he was very disappointed in his behavior, and he was very embarrassed, and he was very very afraid of disappointing either of us.
And
And
probably other people in his life too. I mean,
oh yeah,
again, there's all these stigmas that come with, and and remember at this time too, we're dealing with my sister who had severe active addiction at the time and like literally, checked all the stereotypical boxes of somebody who was deep in addiction. And it's not like he wasn't aware or didn't see the treatment that happened during that period of time or how people reacted to that knowledge or just general society. So you think about, just he was aware of the fact that, you know, people would look at him differently if they knew what was going on.
right, right. And I think that it took. I think his subconscious came out that night that he finally admitted to me what was going on, because I think he subconsciously was reaching out for help when I finally called him on his behavior, and
Yeah.
how it was affecting us. And something about that night, he finally was in a position to where he realized that like he couldn't handle it. And even though throughout that conversation he kept fighting us and kept saying that I can do this myself. I can fix it. I know what I need to do. I can fix this myself. He was very adamant on that front, but he never he didn't put up so much of a fight at that point
As like
anymore.
he normally would have to go to the
Right.
hospital and things like that. And
Right.
I think now
I think he
playing behind the
finally
scene.
recognized, somewhere in there that he needed help, and that he couldn't do it on his own, even though outwardly he was saying that he could.
Yeah, and I can tell you probably what was happening that kind of got him to that point. Is that again, we pieced together later that the drinking started the summer before he died, where it not drinking, because obviously he's drank socially and drank regularly throughout his life, but like the switch over into it becoming out of control happened the summer before he died, like probably June. So he died in March, the June before. And again, we'll get to that part in the story later, but like I was able to get confirmation of that. But there was a very distinct sort of change in his behavior, and escalation of certain things around a certain time period. And so there was a pretty strong suspicion on my end and maybe even yours that that's probably when it started. And the 3 weeks before he told you, or like, or that he had been drinking uncontrollably for 3 weeks, which, yeah, you know, you could have some challenges there, but you have to be drinking pretty consistently over a longer period of time for it to really be challenging to detox and or to try to stop. And the I think when he realized that he actually needed help is because he was trying to do it on his own. So in the month of November, he typically had most of November and a good chunk of December off because of the holidays for his job. And he traveled to clients. Most of the types of clients he saw were shut down over that like between Thanksgiving and Christmas. And they would do like maintenance and updates and things like that. So he often didn't work, kind of during that time period. And so he was trying to stop drinking on his own. And I remember that period of time, the 3 weeks prior leading up to him kind of revealing this information to you, that he was sick a lot. Like he wasn't feeling good. He was sleeping a lot. Um he constantly was having stomach issues, and just it kind of like it seemed like he had like a bug that he was just
Mhm.
kind of fighting.
When
And
in
like some days
reality he was withdrawing, and he
he
was
was
because he was
withdrawing.
trying to stop, and he realized that he couldn't.
Yeah, because it's like he would try for a while and then the withdrawal symptoms would get so bad that then he would start drinking again, which made sense because he would kind of be sick for a few days and not feeling well. And then he seemed to kind of be recovered, and then, maybe a few days later, he'd start to get sick again. And it was because he was trying to figure out how to get it to stop on his own. And I think that that's when he really started to realize that he had a problem, because he was just like, I can't stop or I get really sick. And then I have to basically wake up in the morning and have a drink. Like that's the point it had gotten to.
Right, and that's what I was gonna say is he even admitted to that of, he said that he would try to stop, and he would get really sick, and the only thing that would make it better is alcohol. And that was kind of the
Mhm.
point that he realized that he couldn't stop. And then I think he was starting to panic a little bit, and I'm sure it was a kind of a relief to him on some point when I finally confronted him, and he was able to just let it out. And like I said, he didn't really fight us that much about going to the hospital or like getting stuff figured out at that point. The interesting thing about addiction is the way that it morphs your brain. And you were saying earlier in the other episode that he had put up a wall with you, at a
Mhm.
certain point right around that summer, which is right when we suspected he kind of fully slipped in. Earlier you had said that he kind of had a little bit of an unhealthy relationship with alcohol in relation to his anxiety. So the interesting thing about alcohol, and I was watching a podcast recently, Jordan Peterson and Erick Edmead, I think is his name. They did a podcast recently, but there was a part in there that he referenced, or that I found very interesting, where they talked about alcohol. And Jordan Peterson put it very eloquently about how alcohol is very dangerous because it reduces anxiety. It's a social lubricant. And then on a third point, it can produce psychomotor effects, similar to like other you know major drugs. And if you're some people are especially predispositioned to that sort of thing, is like genetically even, where
And
it
like
can be especially
clarifying that in small amounts or like in a moderation,
right.
those are the effects that alcohol can have on you.
Right. And so for somebody who has anxiety, and especially severe social anxiety, alcohol is like a magic drug. It's scary good at how well it helps you in those ways. The problem with it is that it's so good at that people become reliant on it for their social lives, and for sometimes
Stress.
it's for stress. Well, and sometimes even just exactly what happened to him, daily life and anxiety. The only thing he said he was getting, I remember having a discussion with him before he died. Where he talked about he would get so anxious and so pent up, and the only thing that would take the edge off was alcohol. The only thing that he knew of that could fix it was alcohol. And it's all an illusion. It wasn't the alcohol that was fixing it. It was helping, but it wasn't fixing it. It was just depressing, those feelings. It wasn't fixing the problem of them. So
Mhm.
it started from a place of self-medicating. And I know you and
And
I
you
have
got to
talked.
remember, I was going to say, and you got to remember that like alcohol is socially acceptable. It's
Easy
easy to
to it.
buy.
Yep.
People don't look at you funny unless you're behaving badly, quote unquote badly in public. They don't really think twice about it. If someone's having a few drinks a day or a couple cocktails in the evening, or going out and partying on the weekend, because it's part of our culture. So it's a slippery slope, especially if someone is predisposed or is using it in a way that to cope with life. It's a slippery slope, and it's easy to attain.
Well, and it's also, back on the withdrawal part of it. It's interesting that it's known that alcohol withdrawal is one of the most dangerous types of withdrawal because of the things that we talked about before. And that's the exact reason why liquor stores remained open during COVID,
Mm,
because they were
absolutely.
essential workers, because there's alcohol addiction is such a problem in the United States, especially
Or
that
dependence, even not just addiction, because addiction has a psychological component to it. But
right,
if you have any substance that you take for a long period of time,
you can become
your body
physically
can become
dependent on it.
physically dependent on it. So there is a difference between the two. But regardless of whether you're physically dependent on it or you're in full blown addiction, you can't stop drinking without there being horrendous, potentially life threatening side effects.
Right. And so that's why, liquor stores were essential workers or essential businesses during COVID, is because if the liquor store shut down and people couldn't get access to alcohol, people would start dying, from
We would
withdrawal.
have a mass influx into the hospital for that. And we're trying to prepare for COVID and how to deal with that,
Right.
system stress. So,
Right. Well, and in regards to, my dad and his predisposition to alcohol, and the reason why he got himself into what essentially ended up being full blown addiction, is he was already, first of all, genetically predisposed, because I believe he has family members who, relatives of some sort, who are addicts or have alcohol use disorder or that sort of thing, whether
right.
diagnosed or
Yeah.
undiagnosed. And then on top of, so that sort of thing does run in the family. It's a hereditary thing that's known. And then he also has a high tolerance for alcohol naturally, which is something that
Mhm.
I've inherited and I've had to be careful with because it's very easy when you have a high tolerance for alcohol to, even if you don't feel the effects, you can still overdrink.
Yep.
Um,
And his whole family, all of his siblings, they all have high tolerances to alcohol. So it when we say that he had an inherited tolerance to alcohol, like it wasn't just a thing that was made up that like he drank a lot from the beginning. It was just that he naturally had a high tolerance. And, when most people might feel a little bit tipsy after one drink or two, it took him three or four. And that was as long as I've known him. So, and it is something that has been notable, throughout other family members as well. And like you said, you inherited that predisposition to having a high tolerance to that.
right, right. It's very, even if I go a long time without having a drink, uh, if I have one drink, I rarely feel it. Even on an empty stomach,
Hmm.
I rarely feel anything. Whereas I know people
Yep.
who can have one drink and that's all that then they're good, you know? Um, and with him especially too, having anxiety and like I said before, severe social anxiety, alcohol is the perfect drug to solve that problem or seemingly solve that problem. And I think he figured that out fairly early on. And he would use that, whether consciously or subconsciously, as like his social lubricant. He often would have a couple drinks
Hmm.
whenever there were people around or whatever. And that was part of his job too. Like he entertained for his job. Like he would bring clients out to dinners and stuff. And that was kind of part of the culture is having some drinks, bringing out dinners, doing kind of like a sales meeting or
Yeah.
whatever. And the interesting thing about that with him is, so you have this hereditary disposition to alcohol use disorder, alcoholism, whatever.
Or
You have a high,
substance.
whatever. You have a high tolerance, and you have social anxiety. So it's like this perfect cocktail for him. And so whenever, so I, we've talked about this before, but this was kind of a, I think you mentioned this previously, that this was kind of like a point in your marriage that was a friction point, is his, you recognize that he would use alcohol as a tool for his anxiety sometimes, whether he knew it or not.
Yeah.
And
I mean, like, yeah, let's back up on that a little bit because we actually didn't really touch much on the alcohol outside of the fact that all of a sudden we found out he had been drinking excessively. Um, so again, like I said, as long as I've known him, he's always had a high tolerance to alcohol. Obviously, when you're a teenager, you like to have fun, you hang out with your friends, you drink alcohol, and you know, um, having 4 or 5 in an evening, six, whatever, like nobody thinks about it. And even, uh, throughout life, I wouldn't characterize him as having had a drinking problem. And my issues with him around alcohol had nothing to do with the fact that he had a full-blown issue at that point. It was the combination of me growing up in the environment that I did and being very, very consciously aware of mental health, depression, anxiety, all the things that come with it, and then having very close access and experiencing, kind of how substance abuse develops and recognizing the correlation between the people not having the right coping mechanisms and leveraging substances like alcohol to cope with things that they don't know how to cope with, whether it's feelings or emotions or anxieties. So I knew this at a very young age. And so our friction point really had to do with the fact that I noticed very early on that there seemed to be a little bit of a correlation with him leveraging alcohol as a way to like you said, like deal with his anxiety or make himself feel a little bit more comfortable in social situations. And again, it wasn't like he was drinking excessively. over the period of time. It was just sort of the pattern and the way that he was doing it that I would be like, this is not healthy. It's
Some sort of
problematic.
alarm bells were going off, like this is an unhealthy relationship. Not that you have a
Exactly.
problem, but it's not the way that you're drinking, the way that you're using alcohol as a tool is
Mhm.
is a problematic path to be on.
Right.
And but you don't really, I think that was a friction point, but you didn't really recognize kind of the full-blown danger of that, up until everything kind of came to a head per se.
I didn't recognize I recognized the danger. I didn't recognize the level to what extent, like how bad it had gotten for him. Like again, in all the time that he was having weird behavior, and even when I suspected, like, am I being naive? Is he using some sort of drug? That sort of thing. It never occurred to me, even though we had friction around alcohol and him drinking alcohol, it never occurred to me that alcohol was the problem. And you have to remember, as Isaac said, it's because we had gotten to a point where, and again, I wasn't trying to be like, don't drink. I just was like, you're again, as the years continued to go on and his anxiety became more and more apparent, and it became more apparent that he would use alcohol to sort of take the edge off. I was really trying to help him take that step towards getting proper treatment for his anxiety. And that was the friction point, is
finding
because
finding a more healthy coping mechanism than trying to
right.
self-medicate a little bit with alcohol. Everybody.
Right, and
And I
because
think,
I it's a s well, it's a slippery slope, and I knew that, and that
right,
was the challenge, but he didn't see that, and part of it was he probably didn't want he again, embarrassment, stigma, shame around just mental health in general, like, God forbid he had anxiety or, like, depression, like, those were labels that he didn't wanna have, and then
right.
he didn't also want to admit that maybe alcohol was problematic or that maybe it isn't the best tool for him. And if he goes in and gets help, whether it's medication or therapy, there is this cultural, you know, idea around this stuff that's getting better now. But at that time, where it was like, if you're in therapy or you need anti anxiety or depression meds,
There's
something's
something
wrong with
wrong with it.
you.
Yeah, it's
Hmm.
well, and the other thing with him too about having a somewhat unhealthy relationship with alcohol, in that he was using it for the wrong reasons, let's say,
Hmm.
at certain points. And again, it's not like he ever had a full-blown problem with it. It wasn't ever like he overdrank or was drunk ever. Like, he never, I don't think I ever saw him like drunk per se.
Yeah. Yeah.
Very,
And
but
he would drink higher quantities because, again, he had a higher
that's what
tolerance.
I was gonna say. Is he, I never really ever saw him really drunk, but he would drink high quantities of alcohol. Like, it wasn't uncommon for him to have 4 or 5 beers, you know, in a night, if he was, even if he was just relaxing at home sometimes. Like, after
Yeah.
a long day of work, he would crack one open, and then he would crack an, and then by the end of the night, there's 4 cans in the garbage or something.
Yeah.
And the thing with that, that's kind of also part of his downfall with having the higher tolerance and the predisposition and stuff, is when you're trying to use alcohol to reduce your anxiety, which means you're drinking with the purpose of feeling it, not just for the taste or anything like that. You're drinking for the purpose of feeling its effects so that it can
Mhm.
reduce your
The that
anxiety,
initial that initial relaxation that comes with
right?
generally
Just that
smaller
just
amounts of alcohol.
just that little buzz. You're
Yep.
drinking to feel that, but you have a high tolerance. You have to drink 3, 4, or 5 beers, or a couple shots of liquor or
To
whatever
get that.
to
Yep.
get that feeling. Well, then when you're doing that, you know, when you start doing that multiple times a week or night after night, eventually it becomes that slippery slope where now your tolerance is building because you're drinking more and you already have a high tolerance. to start with.
Mhm.
So now to feel the effects, you have to feel just that little buzz. You have to drink a quarter bottle of vodka.
Yeah.
You have to drink
Yeah.
a six pack of beer. You have to drink 7, 8 beers. You have to drink a half bottle of vodka. Like,
Right.
it slowly snowballs, and that's kind of what he was trying to explain initially, is that it just slowly snowballed and got out of control to where, in order
Mhm.
to feel the effects that he was going after, those nice calming effects, the social lubricant effects, he was having to drink more and more to get to that point. And then by
Yeah.
the time he was like, "Oh, this might be a little too much. I need to cut back," he no longer could
It was
without
too
getting
late.
sick. Yeah.
Yep.
And at that point he was, he was full blown addiction. He was buying cheap bottles of vodka and hiding them out in the garage. That was his
Yep.
strategy. That's why he was going out in the garage so much, during that
Well, and
period.
it's because he knew that if I saw the quantity that he was drinking at that point, because it's not like we didn't have alcohol in our house. And this is again why it never occurred to me that it was alcohol, because we had had a discussion like, hey, it seems like, maybe this is just like you should take a break from it. And he agreed. And then he wasn't drinking at home. So, like, there wasn't alcohol missing. uh, you know, I wasn't seeing him have several, a handful of cocktails in the evening. He might have one, or, like, it was very much appeared to be balanced and in moderation and kind of just more of a normal relationship with alcohol. And so that's part of the reason it never occurred to me that that was the issue, even though it had all these classic symptoms and signs. And he knew it was out of control. So he started hiding it. And I also want to just really point out, too, that, like, again, I knew something was off, and I suspected that there might be some sort of, like, again, there was a point where I was like, is he having an affair? Well, yeah, he was having an affair with alcohol. That's why he was emotionally disconnected
Right.
and checked out, and, not having a libido, not being interested in sex, like all the same symptoms of maybe someone having an affair. That Yeah, he was having an affair with a bottle. um, and then two, I think he I don't know, I lost thought.
I think ultimately, his situation with getting to that point where, I kind of touched on it earlier with the mental state of how it warps your mind, but it was interesting. Well, it was very traumatizing, but looking back, it's interesting to realize the mindset that he was in regarding the addiction, because he was very afraid of letting it go. He, like, part of the reason why he didn't want us to know about it in the first place is because he was afraid of having to stop altogether, and he was afraid of
Yeah.
like, being in sobriety. Like, that was a terrifying thing to him, of
And again,
having to give up alcohol altogether, having to give up what essentially at this point, in his you know rise or fall to addiction, um was the love of his life at that point in his life.
and
uh
remember that um he, again, we didn't know this at the time, had severe social anxiety. So you compound that with the thought of having to engage in his day-to-day life, which included a lot of socialization.
mhm.
It's terrifying
Without the
to,
help of alcohol, you know
and not really recognizing, which we'll talk a little bit more about, as we get deeper into what happened afterwards. But he he because of his resistance and trying to treat any of this prior to kind of this slippery slope that he went down, he didn't understand the benefits of managing that in healthy ways, like therapy and medications and things like that. And so his fear was valid because he didn't know that there was another option to treat that and to actually get relief from it.
Right. The only
And
the
so
only thing in his life that he's ever experienced that helped him with his feelings of anxiety was
was
alcohol.
alcohol.
That was
Yep.
the only
And I
thing
think
that was and that became his only coping mechanism with his anxiety
mhm,
was the alcohol. And I think that's the most pervasive, like, dangerous part about alcohol as a drug is it is so good at helping, well, quote unquote, helping with anxiety. It doesn't really help. It reduces the effects in the moment, but it ultimately makes most other parts of it way worse. And in the long, and also if you're drinking on that level, your
mhm,
anxiety goes through the roof when you don't have alcohol.
yeah,
And back to that, that point earlier about the podcast that I was making. Another point that they made that I found very interesting was, I really resonated with, is that a lot of people um, these days don't learn how to socialize without alcohol. Like into your
our
later
culture
teenage years,
especially.
yeah, into your later teenage years or early adulthood, when you start to get access to that, and then every social occasion that you go to, alcohol is there. And again, it's very good at being a social lubricant. It's very good at lowering your inhibitions and your anxieties regarding, you know, dealing with other people and being a sociable person. And many people slip into that where they learn how to be, they become more social with alcohol, and they learn to use it as that kind of tool, that social lubricant, and then they don't know how to function socially without it. And that is a
Mhm.
very dangerous path to be on as well, because first of all, if you don't know how to socialize without alcohol, um, it that presents a whole other set of problems when it comes to your personality and your ability to deal with the world, um, in just a psychological point of view, um, and like a self-awareness point of view, I guess, or self-fulfillment.
Yeah.
I don't know the exact terminology to use, but um, if you're unable to socialize without the use of a substance, it's difficult, and it presents a problem in your development. That's what I'm trying to say. Your
Mhm.
development. Um,
Yeah.
it stunts your development socially, basically, and so a lot of people don't learn how to navigate the world without it. And I think that was part of my dad's problem, is he never really learned the coping mechanisms or the tools to navigate the social world that we live in without the use of alcohol.
And also, I mean, and just so we don't forget, like this episode of this podcast in general and the podcast in general, which is awesome. We'll reference in the description for the podcast, and provide a link because it's very eye opening. But I think also it's important to recognize that it's not that alcohol is bad in
Hmm.
itself. Alcohol is not the problem. The problem is not learning healthy coping mechanisms from a young age and not dealing with mental health issues. Those
Hmm.
are the things that drive that problem. So like the alcohol was a byproduct. It wasn't the problem. The problem with your dad was that he was not dealing with his mental health, and I don't even think he knew how to articulate it. Like, I don't think he knew how to be like, "I am feeling this way," or even communicate how he was feeling. And so that was part of the challenge. And, just to kind of go back a little bit too, I've just remembered the other kind of point I was making around, um I said, it was kind of like he was having an affair. But the other reason that I was not able to really pick up on what was going on with him, because again, got to remember we were super intertwined. We grew up together. We had a combined bank account. Um I managed all the finances. Like, he didn't like to balance the checkbook or keep track of bills or do all of that. Like, he was happy to have me do that. We shared a checking account. We didn't have credit cards at that time, so everything we paid for was in cash. Um, there were no signs of him, because I would look, like, again, it wasn't like it didn't cross my mind that maybe he was using something. But there was nothing, it wasn't like he was taking out an abnormal amount of money, like, he took out the same amount that he normally took out. It wasn't like he was, but, doing transactions. He didn't have, like, a separate checking account or a separate, you know, part, like, money going into a private area that I didn't see or wasn't aware of. We didn't have, he you would get into my phone, I got into his phone. He knew the password of my computer, I knew the password of his computer. It never was even anything that we even thought twice about, because again, we had that level of trust where, like, there was no reason to need that level of privacy from each other. So that is also just, I think, an important point to point out, is that if somebody really wants to hide something from you, if there is a will, there is a way. They will figure out a way to do it. And, I'm not going to go into exactly how he hid his purchases, because I don't want to give other people ideas for how to hide their stuff. Um, but it was pretty crafty, and it literally did not raise any red flags. It did not, I couldn't figure it out, and it drove me crazy, because I was just like, "There's something going on," and you know me, I'm like master detective over
Mhm.
here, and I couldn't figure it out, and he refused to talk to us about it. And,
Right.
you know, I think after we found out what was going on, that was a really difficult thing to come to terms with, is that he was in so much emotional pain that he didn't know how to tell us, and he didn't know how
Mhm.
to talk to us about it. And he turned to a path of using, alcohol to make him feel better, and
Self-medicating.
slide yep, self-medicating, but sliding into this deep dark hole, because ultimately the more you drink, and remember, it's a depressant. So if you're already depressed and you have anxiety, a little bit might take the edge off. But if you're drinking heavily, consistently, it makes you more depressed. It makes you more anxious. So he was sliding into this dark hole, and it broke my heart to know that he was in so much emotional pain, that even it got to that point in the first place. But then just imagining how awful it must have been for him, and how isolating it was to be kind of grabbed a hold of by this thing and no longer having control over it, and feeling worse and worse and worse about himself, and not feeling like he could talk to us about it. And, I think that if I can say anything to anybody, and I think that you would agree with this, is that the people who love you, that truly love you, not the toxic relationships, like the true love, the people that truly care about you, there's no judgment there. Any of us would rather have known the struggles that he was having and been able to help him with it, and have him come to us and let us help him with it, than to have him get to a point where he was so dark and so isolated and so sad, and just having that level of emotional pain. Like, it still breaks my heart when I think about it.
Yeah, I mean, especially when you love somebody so much and they don't love themselves, if anybody's ever experienced that, where you see the value in somebody, you really love them, you really care about them, and they clearly don't care about themselves for whatever reason. um it can be I mean, it's devastating to witness, because here we are seeing all of his value and all the things that he brings to the table and all the love that he has to give, and yet he doesn't supplement any of that to himself. He doesn't. and he really, he essentially got to a point where he hated himself. And that was the whole thing when he had that breakdown of like where he said that he hated his life, he hated, or that he was so unhappy. And he was very, very purposeful in making sure that we knew that it wasn't us, that it wasn't us who was the problem, because he loved us so much. But he was in his own deep dark pit of despair. And for a long time, we had no idea how bad that was. And again, thinking back to that period of like, we cared about him so incredibly deeply. And he was in that point where, he having dealt with, I would say, comparatively very mild levels of depression in the past, like, um, I can't imagine what that was like for him. And it breaks, like you said, it breaks my heart to realize that, and I think on that point that you were talking about before, right? Of alcohol was not the problem, and it wasn't the solution either in his own um, twisted way of thinking, because he eventually, like I said, it became full blown addicted to it. And with addiction, it literally changes your brain chemistry. It changes the way you view the world. It changes the way that your relationship with everything, um, and the way that it twists your brain, even from a clinical perspective. It it literally changes your brain chemistry to um, to feel like you can't live without that thing. So when you're addicted
Mhm.
to something, your biggest fear is losing that thing. And that was part of the point that he was at, is he was so afraid of having to give up alcohol completely because it was the only thing that ever made him feel better. But he was at a point
Mhm.
where it was destroying him. And so
Yep.
I'm sure for in his own internal battle of like his subconscious and his conscience and his the devil and angel on your shoulder or whatever, one side of him was saying, you can't give this up, it's the only thing that makes you feel better. And the other side of him was saying, this is destroying your life, you have to do something about it, you know
And I think
and
many people who struggle with that type of with any substance is or any sort of addictive behavior can totally relate to those feelings.
well, and just in general, like, I've over the years have had other friends and things have um who have I pointed out to them, like, hey, I think that you probably have an unhealthy relationship with alcohol. And I've had people tell me that, like, oh, you're just sensitive because of what happened with your dad. And it's like, no, well, maybe yes, but also I'm sensitive because I've seen it happen firsthand, and I know how these things start. And if you're at that point um where you are afraid of giving up a substance um because you're afraid of losing out on it, on the way that it benefits you, well, you're at a very dangerous point in your relationship to that
Mhm.
substance. um and if you're using it to cope with something or to benefit yourself, socially or whatever, like, I saw an interview with Tom Holland recently, where he was talking about how he gave up alcohol. And he was saying that um, part of the reason for that was he he realized that he didn't want to give it up, and he recognized that that was a weird problem. Like, why am I so adamant that I not stop drinking? And so he stopped, and he still felt. And then after like a month, he said, I still felt like, you know like I still had this deep feeling like I needed to have it. And so I prevented myself from having it because I recognized that that was problematic. And then eventually he got to, by the time he got to the point where he didn't feel like he needed it anymore, he also recognized, he realized that he was the happiest he had ever been. And I thought that was a
Mhm.
really interesting point because, that that's kind of that tipping point for a lot of people where they do slip down that path where when you start to get to a point where you don't feel like you can live without it, that's a very scary point to be at with any substance, especially
Yeah.
I would say alcohol.
Well, and I think too, the scary part that comes into it specifically with alcohol, and I think alcohol is more insidious and more dangerous even than some other substances in the way that, I mean, nicotine is as well. I mean, in terms of like its level of addictiveness,
But
because
nicotine
of the
can't kill
social.
you. Smoking can, but
Well,
nicotine
exactly.
can.
Exact exactly. I just meant in terms of just, how easy it is to slide into sort of becoming dependent on it physically. But, and how and that it's legal to do, right? So that's the big thing is that a lot of times people, because it's legal to drink alcohol when you're of age, you can purchase it, and it's so like, this is the important point, it's socially acceptable.
Mhm.
You're not gonna get the kind of reaction to you if you were, having a few beers in public that you would if you were, you know, lighting up some other type of drug or, you know, taking some illegal substance. There's a different level of stigma around illegal drugs. And so alcohol is, I think, far more dangerous in a lot of ways because it's socially acceptable. And it's not something that people even think about as being like an issue. And it's very intertwined in the fabric of our culture. A lot of people, I mean, us included, you have beverages, you have people over, you entertain, you have wine, you have cocktails, you go to the dinner, you have, and for anyone who is able to do that in a healthy way, there's absolutely nothing wrong with alcohol.
Mhm.
Um, so then you take that and you take somebody like Eric, who is now terrified of dealing with the core issues of what's really causing these feelings, and say, well, you might not be able to drink alcohol ever again because it's at that point now. It's a scary thing to go, okay, everybody else can enjoy it and it's part of our social dynamic and it's part of our socializing, and now like I'm the person that has to be like, no, I can't do that.
Well, and it's also interesting because there's almost more of a stigma to saying, to being at an event and somebody offering you a drink and you saying, "No, thanks, I don't drink." Even if you have your own personal reasons, there's so much of
That
a
have
stigma
nothing to
behind that.
do with addiction. Yeah.
Right, but there's so much of a stigma behind that. Like it's like, oh, there's something wrong with you because you don't drink, and it's like, well, no, just because I don't choose, just because I choose not to partake in, in that doesn't mean that there's anything wrong with me or that I have a problem. It just means that I don't want to, or I don't need
There's
to.
lots of reasons not to drink. I mean, there's a lot of
Right,
benefits. I mean,
but
yeah,
there's a
having
huge stigma.
beverages. Yeah.
There's a huge stigma around not drinking as well. Like if you're at an
Yep.
event and everybody's drinking and somebody hands you a drink and you say no thanks, I don't want one, everyone's like, "Oh, what? You don't drink?" And it's like, especially in the younger crowd, like college and that sort of thing, it's like
Yep.
it's this huge issue. Um, and
And speaking of just kind of to cover a different side of alcohol, obviously we're sharing our experience and what happened to Eric. And I think the reason it's so important and why we felt like we needed to talk about this and exactly what happened is because Eric doesn't fit the stereotype of an alcoholic. It
mhm.
He didn't look like one, he didn't act like one, he was high functioning. Uh it it caused some minor friction in our relationship and irritation, but it wasn't something that became a huge issue until, like you said, right when it actually went downhill and he crossed that line from problematic to addiction. And so, you
And
know,
also ultimately that was only probably 6 months of his life that he was full blown addicted or like full blown dependent on alcohol. It's probably I mean, midsummer to December that that he had that flip to
He was
from it
actively
being
that he was
unhealthy
actively drinking.
to yeah, from when it
Yeah.
flipped from being maybe a little bit of an unhealthy relationship to alcohol to full blown dependence on it. I mean, he was only in that state for maybe 6 months, somewhere in there, and just to see the impact that that had on his whole life, his whole social dynamic, his whole, his relationships with us, and even started having an impact on his health. Like, the other scary thing about alcohol on that level, and I see it all the time in the emergency room, and I know you do too, is
Mhm.
the effects that it can have on your body, even in a very short amount of time. Um, you know, a drink here or there, or like a few drinks socially once in a while, is not a big deal. It's not gonna. But I'm sure most people have experienced, what a hangover feels like. You might get like a stomach pain or a headache or whatever, um, and it's often joked about in like pop culture and that sort of thing. But when you're at the point of dependence, um, there's so many things that alcohol does to your body. Like, it literally starts to destroy your body, where you end up with pancreatitis, which is like, or gastritis, or like inflammation of your gut, because the alcohol is so harsh. It degrades your brain. It
Liver
causes
issues.
liver issues and kidney issues and problems with your blood, and like, it affects every system in your body. It affects all of your organs. Um, and again, in
And it's
moderation,
a slow progression.
right? In
It's not like
moderation,
it just do it overnight.
right? Not moderation. It's not that big of a deal. But when you're at the point of drinking every day, you know, um,
Heavily
yeah,
drinking every day.
it's it can have a tremendous effect on your body very quickly. Um, and the amount of times that I've had to even tell patients in the ER who come in with like severe stomach issues or whatever, and they end up having pancreatitis, and you ask them, how often do you drink, and they say, oh, I'll have, you know 3-4 beers a night, or 2 glasses of wine a night, or whatever. um but they've been doing that for months and months and months, and it's every night. And 2 glasses of wine is not 2 glasses of wine, it's 2 full glasses of wine, or something like
Yeah,
that,
I
right?
mean, we're Americans. Everything is supersized.
Yeah. S- so, clinically that ends up being too much, but again, and then you tell them, like, this is because you drink. This is because you're drinking too much. You need to stop. And then you see that same person come in a month later, or a week later, or whatever, with the same problem. And, again, it's that same cycle of, I don't want to stop drinking, but now it's hurting my body, and I
Mhm.
can't stop without help or whatever. And so getting back into that point of that night, we this all came to a head, and I was not a nurse at this point. I had no background in any of the mental health stuff. I had no background in addiction. I was a 17-year-old kid. My world had just blown up, and you went into crisis management mode, and you
Mhm.
recognized the danger point that he was in, because he had been heavily drinking for likely months, but especially trying to stop for the last 3 weeks, and he couldn't.
Mhm.
um,
Mhm.
so you knew he had to go to the hospital. You knew he had to go to detox.
Yes, again, because at that particular time I worked on the cardiac um, med surge floor, and uh, that floor is where you get admitted if you're in active alcohol withdrawal because of the potential risks for cardiac arrest and then
Seizures.
seizures. And so there is there's a process to it's a a medication assisted withdrawal, and it's very closely monitored. And again, I had been working, on that floor for a couple of years, and then also again studying my RN and being very aware of mental health in general and addiction because of my family situation. I was very aware of how incredibly dangerous this was. And your dad put up a little bit of fight, but I was like, you have to go to detox. Like, you cannot do this on your own. Clearly, you can't anyways because you've been trying and it didn't work and you weren't able to. But also, like, this withdrawal can actually kill you. And so you need to do this in a way that is safe. And so I remember he put up a little bit of a resistance, but again, I think he realized at that point that, like, he needed that help. And so it took a little, he put, I would say he put up a token resistance, as in, like, he wasn't going to just fully cave because it's not in his nature, but Eric never did anything that he didn't want to do. Like, it didn't
So
matter. You
at
couldn't talk him
on
into
s-
it.
on some level, he wanted the help. He recognized that he needed the help, and so he wasn't going to fight it as much as he normally would. Um, and I remember, you know, going to the hospital that night, and we waited, and mind you, he was intoxicated. Like, he was in one of his, like, I initially had
Well,
thought he was in one of his sleep episodes where I thought he was just overly tired. Well, actually, he was just intoxicated and, like, um, in that state. And I have no idea how much. I don't think we ever got to know how much alcohol was in his system that night. But I
I
remember we
don't think
sat
he
in
had
the.
I was going to say, I don't think he had that much because I think, again, even though upon the time you guys were talking, I do think I just think that his body was very sensitive to it at that point, in terms of that his reacting to it. But he had said to me that he was still trying to stop. So, like, he had drank less that day, which means that when we went to the hospital, he was already starting to be in withdrawal, which made the hospital thing more difficult because he's starting to get antsy and feel anxious and starting to have withdrawal symptoms.
Well,
We went
and
to
I was just going to touch on, like, what those are. For people
Yeah.
who don't know alcohol withdrawal symptoms in the hospital, we actually have a protocol called CWA, and I don't remember what it stands for, but it's like a diagnostic tool to see what level of withdrawal you're on. And kind of the main symptoms that you look for alcohol withdrawal is tremors, where your hands are shaking uncontrollably, um, headache, nausea or vomiting, anxiety, agitation, which is like,
Or
increase,
irritability.
or irritability, or, like, also agitation is like activity levels that are higher than normal. So if you're fidgeting a bunch, you can't sit still, that sort of thing. Um, and then there's also you can start to hallucinate. You can have both visual and auditory
Mhm.
hallucinations. And then also, you can become disoriented and have altered mental status, where you're confused and unable to do, basic time, date, person, place, unable to do basic math, or that sort of thing. Um, and
You
those
can
are kind
also
of.
have weird sensations, like
Oh, yes.
tactile sensations.
Pins
And
and needles, or like that static feeling you get when your leg falls asleep, like that sort of the nerve,
yeah.
um the high firing nerve feeling when, like, your leg falls asleep and then it finally wakes back up, and, like, when you feel that static feeling, it's your nerves kind of firing again, basically.
And just to clarify, from a hospital standpoint, when we're using that assessment tool, that tool helps us determine the severity of a lot of those symptoms, because that determines, you know, how we treat it with the medication. And again, they're not trying to be stingy with that medication either, because we do not want someone to have a seizure or cardiac arrest. So
Right.
it's, critical to make sure that those medications are on board, um, to prevent that from happening.
Yeah, and so, well, and the thing with helping people to detox from alcohol and to help them detox from withdrawal is, the reason why we use that tool is, it helps us assess how severe your withdrawals are, and if you've had seizures from withdrawals in the past, or you're prone to seizures, or you're going to have a seizure, the worse those symptoms are, the closer you are to possibly having a seizure. And so,
And also clarifying that it still can happen without you can
right.
have minimal symptoms, but yeah, you're definitely more you're at higher risk to have those really, really bad outcomes,
If
with
you're at a
the
very bad
higher.
stage of withdrawal. And
Right.
but yeah, like you said, that tool allows us to taper, to give you medications to allow your body to taper off the alcohol in a safe way that's going to prevent the adverse outcomes. It's still not going to be comfortable. You still have to go through the
No.
withdrawal period. But it helps, it makes sure that you do it in a safe way, that you're not going to die from it, basically.
And it takes the edge off. It makes it more tolerable to go through the withdrawal.
Right.
And let's also caveat that just detoxing off of alcohol doesn't fix the problem. Hey, you know how this works.
If you like this episode or just like us in general, you can find us at It's Going Podcast on all the things.
Don't forget to check out the links in the description.
And thanks for hanging out with us.